6 early warning signs of a brain tumor you should never ignore. A brain tumor is a serious condition that can have a profound impact on your health and quality of life. Even more concerning, its early symptoms are often mistaken for common health problems. As a result, many people ignore the warning signs and do not receive a diagnosis until the disease has already progressed. But did you know that your body often sends early warning signals before the condition becomes severe? In today's video, Healthy Lifestyle Podcast channel will walk you through 6 important signs that may indicate the presence of a brain tumor in its early stages, signs you should never overlook. But first, let's take a quick look at what you need to know about brain tumors. What is an early-stage brain tumor? An early-stage brain tumor refers to the initial phase of tumor development within the brain. According to neurological experts, brain tumors progress through 4 stages, depending on the characteristics of the tumor cells. During the early stage, tumor cells generally grow slowly, and the risk of spreading or recurring is relatively low. Detecting the warning signs early can significantly improve treatment outcomes, reduce the risk of complications, and enhance the patient's overall quality of life. What is a brain tumor? A brain tumor develops when abnormal cells begin growing uncontrollably within the brain. Brain tumors can be either benign, non-cancerous, or malignant, cancerous. These tumors may develop in virtually any part of the brain or skull, including the protective membranes surrounding the brain, the underside of the brain, the skull base, the brain ventricles, the spinal canal, the nasal cavity, and many other areas. The brain is an incredibly complex organ, with each region responsible for controlling different functions of the nervous system. Therefore, a tumor growing in any location within the brain can potentially interfere with vital bodily functions. It is estimated that there are around 120 different types of brain tumors, depending on the tissue from which they originate. Brain tumors may arise directly from brain cells or glial cells of the central nervous system, known as primary brain tumors, or they may spread to the brain from cancers elsewhere in the body, known as secondary, metastatic brain tumors. Primary brain tumors may be either benign or malignant, whereas secondary brain tumors are always malignant. Is an early-stage brain tumor dangerous? A brain tumor is a serious condition regardless of its stage. However, when detected and treated early, the prognosis is generally much better than in later stages. Unfortunately, the symptoms of an early-stage brain tumor are often mistaken for common medical conditions. This frequently delays diagnosis and reduces the effectiveness of treatment. As the tumor grows, it may eventually become cancerous or cause severe complications by blocking the normal flow of cerebrospinal fluid around the brain. This can lead to increased intracranial pressure and other potentially life-threatening complications. In addition, if an early-stage brain tumor is not detected promptly, it may spread to hard-to-reach areas of the brain, or even to the spinal cord through the cerebrospinal fluid. For this reason, it is essential to pay close attention to warning signs and seek medical evaluation whenever symptoms arise. Early detection allows for timely treatment and may help prevent serious complications. 6 common early warning signs of a brain tumor. The brain is enclosed within the rigid bones of the skull, creating a fixed space with constant internal pressure. As a result, anything that develops inside the brain, such as a tumor, can increase intracranial pressure. The symptoms of an early-stage brain tumor vary from person to person, depending largely on the tumor's location. For example, a tumor located in the cerebellum at the back of the head may cause difficulty walking, poor coordination, and problems maintaining balance. On the other hand, a tumor affecting the areas responsible for vision may lead to visual disturbances such as blurred vision, double vision, visual field defects, or even sudden vision loss. The size of the tumor and how quickly it grows can also influence the severity of symptoms. Here are some of the most common early warning signs of a brain tumor that everyone should be aware of. 1. Persistent headaches that gradually become worse. Headaches are extremely common and can result from many different causes. In most cases, ordinary headaches improve with rest, medication, lifestyle changes, or dietary adjustments. However, headaches caused by a brain tumor are typically much more intense. They tend to occur repeatedly, gradually become more severe over time, and often do not respond well to standard pain relievers. This happens because the tumor places pressure on surrounding nerves, disrupts the normal circulation of cerebrospinal fluid, and increases pressure inside the skull. These headaches are often most severe during the early morning hours, typically between 4 o'clock and 5 o'clock a.m. or in the middle of the night, leaving the patient exhausted and physically drained. If you frequently experience headaches with these characteristics, it is important to seek medical evaluation as soon as possible to rule out a serious underlying cause. 2. Unexplained nausea and vomiting. Have you ever felt nauseous or vomited even though you hadn't eaten anything unusual or suffered food poisoning? If this happens repeatedly, especially in the morning or when changing positions suddenly, it may be a sign that something is affecting your brain rather than your stomach. The reason is that a brain tumor can compress the vomiting center in the brain, causing persistent nausea that has nothing to do with digestive problems. Unlike nausea caused by gastrointestinal disorders, nausea related to a brain tumor often feels as though there is invisible pressure building inside the head or body. Interestingly, after vomiting, the headache associated with a brain tumor may temporarily improve because of changes in intracranial pressure. If you find this information helpful, please remember to like this video, subscribe to Healthy Lifestyle Podcast channel, and turn on notifications so you never miss our latest health and wellness updates. 3. Unusual vision problems, papilledema. When intracranial pressure increases, people with brain tumors often develop a condition known as papilledema, or swelling of the optic disc. This early warning sign of a brain tumor typically appears about 2 weeks after other symptoms begin and may improve once the increased intracranial pressure is relieved. At first, papilledema may cause brief episodes of blurred vision without permanently reducing visual acuity. To diagnose papilledema, an eye doctor will use a special light to examine the back of the eye, specifically the optic disc. Visual field loss, hemianopia. If a brain tumor compresses part of the visual pathway or the optic chiasm, it may cause the loss of half or even a quarter of the visual field in both eyes, a condition known as hemianopia. Eye movement paralysis. When a brain tumor compresses certain cranial nerves, it can cause ophthalmoplegia or paralysis of the eye muscles, leading to double vision. For example, damage to the sixth cranial nerve may cause the affected eye to turn inward, while damage to the third cranial nerve may cause the eye to turn outward. Nystagmus. Another possible symptom is nystagmus, an involuntary rhythmic movement of the eyes that makes it difficult to control your gaze. This condition is commonly seen in patients with tumors located in the posterior fossa region of the brain. If you notice any of these unusual changes in your vision, don't ignore them. Seek medical attention promptly to protect both your eyesight and your brain health. 4. Sudden personality changes, irritability, and depression. Have you or someone close to you suddenly experienced significant personality changes? Perhaps they have become unusually irritable, emotionally sensitive, persistently sad, or have developed symptoms of depression without any obvious reason. Certain brain tumors can affect the areas of the brain responsible for regulating emotions, causing a person to become emotionally unstable, lose self-control, or display unusual behaviors. In addition, brain tumors may contribute to insomnia, prolonged anxiety, and even social withdrawal, causing people to lose interest in activities they once enjoyed. Unfortunately, many people mistake these symptoms for ordinary psychological or emotional problems, missing the opportunity for an early diagnosis. If you notice persistent changes in your own emotions or behavior, or those of a loved one, don't dismiss them. Consult a healthcare professional as soon as possible. Early detection may help prevent serious complications and protect long-term brain function. 5. Loss of balance and weakness in the arms or legs. If you suddenly notice that your arms or legs feel weaker, your movements become clumsier, you trip more often, or you have difficulty maintaining your balance while walking, it could be a sign that a brain tumor is affecting the area responsible for motor control. Some people may also experience numbness on one side of the body, difficulty gripping objects, or even uncontrollable shaking of the hands or legs. At first, these symptoms may come and go. However, over time they often become more frequent, more noticeable, and increasingly severe. If you find yourself losing balance easily, struggling with coordination, or having difficulty walking, seek medical attention immediately. Identifying the cause early may help stop the tumor from progressing and preserve your body's motor function. Final warning sign: seizures. A brain tumor can compress nerve cells and disrupt the brain's normal electrical signals, leading to seizures. In many cases, a seizure may be one of the earliest warning signs of a brain tumor. Studies show that approximately 50% of people with brain tumors experience at least one seizure during the course of the disease. However, determining whether a seizure is actually caused by a brain tumor requires prompt medical evaluation. Anyone experiencing an unexplained seizure should visit a hospital for a thorough examination as soon as possible. Conclusion: a brain tumor is a serious medical condition, but when it is detected early, the chances of successful treatment improve dramatically. Your body is constantly sending warning signals. The important question is whether you're paying attention to them. If you or someone you love experiences any of the warning signs discussed in this video, don't hesitate to seek medical care. Sometimes, something as simple as a health checkup can save your life or the life of someone you care about. Always make your health a priority, because prevention is always better than treatment. Thank you so much for watching today's video all the way through. If you found this information helpful, please give this video a thumbs up and share your thoughts in the comments so more people can benefit from it. And don't forget to subscribe to Healthy Lifestyle Podcast channel for more valuable health information and practical wellness tips. As always, Healthy Lifestyle Podcast channel wishes you good health, A long life, lasting prosperity, and endless happiness.